Assalamualaikum everyone. My name is Muhammad Ali Haider and today we will start Pharmacology lecture number 16. So let's dive in. G proteins and second messengers. Many extracellular ligands act by increasing the intracellular concentration of second messengers such as cyclic adenosine 3 and 5 monophosphate CEMP, calcium ion, or the phosphoniesidase. In most cases, they use a transmembrane signaling system with three separate components plus the extracellular ligand is selectively detected by a cell surface receptor. The receptor in turn triggers the activation of a G protein located on the cytoplasmic phase of the plasma membrane enzyme or an ion channel. The activated G protein then changes the activity of an effector element, usually an enzyme or ion channel. This element then changes the concentration of the intracellular second messenger. For cyclic EMP, the effector enzyme is adenyl cyclase, a membrane protein that converts intracellular adenosine triphosphate to CMP. The corresponding G protein GS stimulates the adenyl cyclase after being activated by hormones and neurotransmitters that act via specific GS coupled receptors. There are many samples of such receptors, including beta adrenoreceptors, glucogen receptors, thyrotropin receptors, and certain subtypes of dopamine and serotonin receptors. So, molecular mechanism. GS and other G proteins use a molecular mechanism that involves binding and hydrolysis of GTP. This mechanism allows the transduced signals to be amplified. For example, a neurotransmitter such as norepinephrine may encounter its membrane receptors for only a few milliseconds. When the encounter generates a GTP bound GS molecule, however, the duration of activation of adenyl cyclase depends on the longevity of the GTP binding to a GS rather than one of the receptor's affinity for norepinephrine. Indeed, like other G proteins, GTP-bound GS protein may remain active for 10 of seconds, enormously amplifying the signal. So, spare receptors. This mechanism also explains how signaling by G proteins produces the phenomena of spare receptors. The family of G protein contains several functionally diverse subfamilies, each of which mediates effects of a particular set of receptors to a distinctive group of effectors. Note that an endogenous ligand, for example, norepinephrine, acetylcholine, and serotonin, may other not listed in table but may bind and stimulate receptors that couples to a different subset of G proteins. Other mechanism drug antagonisms. Not all the mechanisms of antagonisms involve the interaction of drugs or endogenous ligands at a single type of receptor, and subtype of antagonism do not involve a receptor at all. For example, protamine, a protein that is positively charged at physiological pH, can be used clinically to counteract the effect of heparin, an anticoagulant that is negatively charged. In this case, the one drug acts as a chemical antagonist of the other simply by finding binding that makes the other drug unavailable for interactions with protein involved in blood clotting. Eliciting different G protein dependent responses. The apparent promiscuity of such ligands allows it to elicit different G protein dependent responses in different cells. For instance, the body responds to a danger by using corticolamines, norepinephrine, and epinephrines both to increase heart rate and to induce constipation of blood vessels in the skin by acting on GS coupled adrenoreceptors and GQ coupled adrenoreceptors separately. Ligand promiscuity also offers opportunities in drug development. Thank you very much for your time. Inshallah, next time I will share the next lecture. Take care. Allah Hafiz.